Ready, guys? Can I start off by welcoming everybody to Western Sydney, right here at Granville, heart of Western Sydney. Can I say thank you for the Premier coming out, thank you to the Health Minister, Brad Hazzard, and thank you to Cumberland Council, Steve from Cumberland Council, welcoming us today. But the most thanks has to go to our health workers today, right behind me. It's fantastic to see you guys here today. We have some fantastic announcements. But can I say to everybody in Western Sydney, especially the LGAs of most concern, it was back in the middle of August that we saw some of the highest rates of COVID cases, that the communities in the 12 LGAs of concern, including my LGA of Parramatta, did it particularly tough. We're here today to say some great news, but on behalf of the government, can I say thank you to all those people that did the right thing, got vaccinated, and today we see those great results. And I'll hand it over to the Premier.
Thank you, Jeff. It's great to be here Sunday with the magnificent health team, but particularly Susan Pearce, who's here, Deputy Secretary of Health, the Health Minister Brad Hazzard, Steve Christou, the Mayor of Cumberland, where this partnership obviously is incredibly important, Emma McCohen, who's Senior Executive of Western Sydney Health, and also Kavita Varshni, the Emergency Specialist at Westmead, who will also speak to us about the progress of this program. But today is an important milestone in a couple of ways. Firstly, at the end of today, QDOS will close. It has been an important centre which has really driven the vaccination rate here in New South Wales, and we've had many wonderful staff, health staff there, nurses who have been on the front line. Up to 15,000 vaccinations in one day occurred at QDOS, and now as we move and transition into the booster program, this centre here, in partnership with the local Cumberland Council, will play a very important role as we continue that program over the course of the next year. And we had National Cabinet on Friday, and it's very clear that this booster program here in our state is going to be critical in order to keep people safe, ensure we can keep New South Wales open. But the effort that people have made right around New South Wales has been tremendous. It has been the crucial key that has allowed us to open up safely. There is still a long way to go, but the effort that people have made right across our state has been second to none. And behind all of that, on the front line though, has been our health staff. And speaking to the many nurses here who have been at QDOS, and to give you the story of Maureen, who's here, who's come across from Ramsey, told me the story just then about how she'd been out in Wilcannia and Broken Hill. When I was looking through the numbers last week, one of the key areas of success for our state has been the vaccine program for our most vulnerable people, our Aboriginal and remote communities. And New South Wales has led the way. Other states have waited for the Commonwealth. New South Wales went out on the front line, went door to door, and that success is a testament to Susan and the entire health team here, the Health Minister, but our nurses who have done an amazing job during this period of time. This centre, as we approach 90% double dose vaccination, will open tomorrow, has the capacity to do 1,000 vaccinations a day, or booster shots a day, and a surge capacity up to 2,000. So this will be a very important part, a very important tool as we move through the next 12 months. Already our booster program, there's around 90,000 eligible people across the state. In the first week, just last week, 17,500 booster shots occurred here in our state, and that's incredibly positive. So this journey is not over, but the success in our state is a testament to our people who have made such a great effort to go out there and get vaccinated. We now move through the booster program. If it's been 6 months since you've been vaccinated, we'll have centres set up, obviously at Homebush, here in Granville, and ultimately through GPs and pharmacies as we move forward. So I really want to thank everyone across the state, but particularly our health teams, our nurses who are behind us, but every single member of the New South Wales health team who have led probably the biggest vaccination campaign in the nation, but in terms of our success, the best in the world. And we couldn't have done that from a government position alone. It has been a team effort, partnering with everyone across our state, and I want to thank everybody for what they've done. Now I will pass to Kavita, who will give us a bit of insight in terms of the vaccination and the work that will occur here, but what's occurred through Westmead. Then Susan Pearce will give us an update in terms of the vaccination program and the booster program. Steve Christo, the local mayor, will talk about the partnership with the New South Wales Government in respect of this centre, and then we'll finish up with the Health Minister.
Good morning. I'm Kavita Varshni, an emergency physician from Westmead Hospital. Western Sydney was at the epicentre of the most recent COVID-19 outbreak, and our hospitals were the front line. Our hospitals and our healthcare staff stepped up to the challenge. We transformed our wards. We introduced new models of care to manage the influx of patients. We worked every day in PPE to protect ourselves, our patients, and our families. We screened all our patients and treated each as if they could have COVID until they returned a negative result. This ensured the safety of staff, of our workforce, and of the non-COVID patients that we continued to care for. We had dedicated COVID buses to transfer patients back home and into community care following their hospital treatment. The patients with COVID were some of the sickest that I have seen. They were struggling to breathe, sick and alone. They could only speak to their family and friends via phone and video calls. Staff stepped in to provide the human connections. But we have seen such a difference over the last 2 months. As of Friday, there were only 2 COVID-positive patients in hospital in Western Sydney. And we had a further 21 COVID graduates, people who are recovering from COVID, who are undergoing further treatment and rehabilitation. This difference is due to the amazing community response and the extraordinary vaccination uptake rates, which has significantly reduced numbers and the pressure on our hospital system. I would like to thank all those in the community who have come forward to be vaccinated, and all the healthcare workers from across Sydney who have worked exceptionally hard to vaccinate Sydneysiders. By doing so, they have helped save lives and helped save our hospital system. I would encourage everyone to maintain the high vaccination rates. If you still need to be vaccinated, please do so today. If you're eligible for your booster dose, please book your appointment as soon as possible. And finally, thank you to all my healthcare colleagues who continually showed up to work during the height of the pandemic to keep our community safe and to help reopen our state.
Thank you. Could I thank the healthcare staff right across New South Wales, but in particular the people that are here today who've contributed to the amazing vaccination effort in southwestern Sydney during the peak of the COVID cases back in August and September. These guys here behind me were part of the teams who delivered almost 1 million vaccines across New South Wales in the space of 3 weeks. We said at the time that we thought that we could do it, and it's only due to the effort of our amazing staff, not just New South Wales Health staff, but people from our private hospital partners, including Ramsay, and all of the support staff, even Qantas, the New South Wales Police, and the list goes on and on with everybody who participated in delivering that amazing result. Now we're approaching the 90% double dose rate. I expect to see that in the next couple of days, as the Premier has said. What an amazing achievement, and it is really beyond our wildest dreams that we got there and got there so soon. But it's not over, and as Kavita said to you all, please, those who haven't yet taken the opportunity to be vaccinated, please do come forward. We want to thank our community for the response that we've seen. It has made such an incredible difference, both to our living with COVID, but also the impact on our health system and the great staff that you see behind us here today. We look forward to achieving that milestone of 95%. We're almost at 94% first dose in our adult population. It's inching up day by day, but we'd really like to see that get to our ultimate goal and beyond. So for us, it's certainly not over, and we look forward to seeing more people in our vaccination clinics, and of course for those very important booster shots. As the Premier said, 17,500 booster shots delivered by the New South Wales Health Clinics across the last week. We expect to be doing many more in partnership with our GP and pharmacy colleagues who've been with us right the way through. As I said, we think that that is one of the most critical things that will continue to keep our state safe as we move forward into 2022. Thank you.
Good morning, everybody. On behalf of Cumberland City Council, I'd like to welcome everybody to the Granville Centre, and we are very excited about hosting this vaccination clinic for the benefit of our local community. I'd like to thank the New South Wales Government, the Premier, Minister Hazzard, and Jeff Lee, MP for Parramatta, and of course, Western Sydney Health staff for their fantastic efforts in supporting our local community. We're very excited that we are donating this centre for vaccination hubs, and we look forward to continue to work together with the New South Wales Government and New South Wales Health to progress vaccinations and do whatever is needed to beat this pandemic. Thank you very much. Enjoy the vaccination hub, and I look forward to talking to you soon.
Good morning, everybody. Look, I think it's fair to say that the last 20-odd months have been gruelling and horrible, basically, for everybody. But we're now seeing the light at the end of the tunnel. But there are still people who are not vaccinated, and of course, we all need to get booster shots at some stage. Can I just acknowledge the work of the health staff who are standing behind me as representatives of the 2,700 staff who worked at Kudos. You know, I think we've seen Metallica, we've seen Bruce Springsteen, Lady Gaga. I tell you what, Bruce Springsteen, Metallica and Lady Gaga, the stars that have previously been at Kudos, ain't got nothing on the people who have worked from New South Wales Health, the 2,700 staff who've been out there. They have been the stars. And along with them, of course, the hundreds of thousands of people who have come in and been vaccinated. Each and every one of us have the chance to be vaccinated because New South Wales Health team members have been there to offer those vaccines. I want to thank each and every one of those staff. They are the real stars that have made sure the rest of us in the community stayed safe. I also want to just indicate to the community that we do still have a big challenge going forward. Obviously, there are some people who are still not vaccinated. I want to thank Cumberland City Council and, of course, the Mayor, Steve, and his team for providing this facility here at Granville Centre. I want to encourage people of Western and South-Western Sydney to still go and get vaccinated if you haven't had any doses as yet. But right across New South Wales, the message is if you haven't been vaccinated, get with strength, go and get vaccinated. And also those who have been vaccinated, boosters are very significant. We don't yet know how many times we will have to have the booster shots, but we know we have to have them. So go and get the booster shot if you've already had your 2 doses. It should be usually about 6 months after your last dose, your second dose. Can I also emphasise that for people who are immunocompromised, so for example people who might be having cancer treatment or dialysis, you should go and talk to your doctor because it is possible that as part of your normal health regime, you should actually be having the 3rd vaccination a little earlier than everybody else. So please go and talk to your doctor and just take that advice. Finally, again, I just want to thank the entire community across New South Wales. To get to the vaccination rates that we have, world-leading vaccination rates, only happens when you've got a community who's prepared to step up and make sure their arm is available for that vaccination. It's keeping us all safe. We do know, as we just heard from our amazing emergency medicine specialist, that the virus has actually been largely pushed back. It hasn't disappeared, but it's been pushed back as a result of these people coming forward for vaccinations. If we hadn't had vaccinations, I dread to think where our community would be. But we have got vaccinations. We have got Pfizer available. We are awash with vaccine. Go and get vaccinated. Don't hesitate. There's no more time to hesitate. Go and get vaccinated.
Minister,
Yeah.
while I've got you,
Hello, Lisa.
just on the issue of, good morning, on the issue of supply, obviously the people coming up for their 6-month booster, there won't be many because it started slowly, but as you just said, you know, 1 million people done in a fortnight in Western Sydney. At one point in time, all of them will come up together for their booster. Do you have ongoing supply?
Yeah, look, the federal government obviously struggled initially because there was a shortage of vaccines worldwide, but the federal government has stepped up and made sure that New South Wales and other states and territories have more than ample supplies of vaccines. So the message is just go and get it. It's there waiting for you. It's there waiting to keep you safe.
Do you expect, Minister,
James?
Do you expect the rate at which we're vaccinated to slow down now that Kudos is closed? I mean, that was a big thing
No, I don't expect the vaccination rate to slow down because of kudos shutting down, but we have been anticipating, and it has happened, that the vaccination rate has slowed. But we're now in the tough end of the vaccinations, where we're now in the end where people who have been reluctant for a variety of reasons are now contemplating whether or not they should be vaccinated. They are coming forward, but they're coming forward more slowly. My message to them is just forget this reluctance, get on with it. You know, there's basically around about 95% of people in our state have gone and had their first dose. So how about you get with the strength and stop with this reluctance?
Just in terms of, like,
Good morning.
morning. To get your booster shots, obviously kudos was so big, this is nowhere near the size of what kudos is. Will we see more of these clinics pop up for boosters, or is it?
Look, what we're envisaging is that the boosters will eventually become primarily the task of GPs and pharmacists, but New South Wales is still going to be there for the long haul. We're still making sure that we have these sorts of centres available to back in those people who perhaps don't have a GP or don't want to go to a pharmacist. But we will do whatever it takes to keep our community safe. The one thing, I mean, I think I've said this many, many times, the one thing I've learnt as a health minister in a pandemic is never say never. We're just not sure at this point what the preference will be from the community, whether they would prefer to stay with these sort of large centres or whether they will be happy to transition across to their GPs and pharmacists. My feeling is, as it becomes more normalised, where do we normally go? We normally go to our GPs for most of our vaccines. So I think that we will see that transition. But we're sorry, 2 seconds. But we are still on the tail end of the major phase of doing the vaccination. So I think we'll have these sort of centres operating for a while. Sorry, yeah. Okay, sorry, Chris, I'll come to you. Yeah.
The Premier mentioned great Indigenous vaccination rates in Western New South Wales. In Northern New South Wales, the rates are much lower, and now there is an outbreak going on in that community. Are you able to give us an update? Do you know what the case numbers were today in Moree?
Northwest New South Wales, talk about Moree. Yeah. Look, what I can tell you is that the New South Wales government has put in a lot of resources, but so has the federal government. The issue is particularly in the vulnerable communities, lower socio-economic, but also the Aboriginal community. Unfortunately, there's a very large funeral, and we saw a lot of people who have contracted the virus and then spread across New South Wales and indeed into southern Queensland as well. It's one of those issues that obviously we would have preferred that people did have their vaccines earlier. Overall, we're working very hard to try and make sure that we beat the social media myths. I know when I was up in Wilcannia, for example, and Walgett and Burke and places like that, what we've heard is that social media is actually sending terrible message to the Aboriginal community. The only way we know to defeat it is to actually get the messages across to the community almost on a one-on-one basis. So what was happening particularly in, say, Wilcannia and Walgett was that the local Aboriginal health workers tell me that the only way in the end that it really worked was to go and knock on doors. And sometimes it took multiple visits to actually ensure that the family, and often a larger group than that, living in the house, would actually come and have the vaccines. But eventually we got there, and we did it well in Wilcannia and in Walgett and in Burke and other areas. I'm quite sure the same will apply, but it's all going flat out at the moment trying to do that. Sorry, Chris, you want to ask something?
I'm just curious about the other Olympic
Sydney Olympic Park.
That's still operating.
Oh yeah.
Yeah, no. Is there a sunset in mind?
No, in fact, we've got quite a long lease and an option on that one. So if we need to, we can keep that operational for at least another couple of years. But we'll see how it goes. Does anybody want to ask somebody else a question?
Just one more for you. One more for you. Apparently there has been a protest this morning, anti-vaccination protest that does seem rather large. I'm being told 1,000 plus people there. What is your message to those people? I know restrictions... Anti-vaccination?
Because I heard there was a climate one this morning.
No?
No, there's anti-vax.
Oh, anti-vax, is it?
Yeah.
Okay. Yeah. In Sydney?
In Sydney.
There you go. Okay, I hadn't heard that, yep.
Yeah, Parramatta, I believe.
Yeah, you're next, by the way.
Well, on that, what is your message to those people? Obviously, they are missing out on freedoms. They've been pushed back. Why was that necessary? Is it fair?
Oh, look. My message to people who want to get out and demonstrate is it is quite dangerous to get out there and to demonstrate when we know that this virus is extremely capable of transmitting, and you may end up being the victim. It's a pretty selfish position, I have to say, if you're not getting vaccinated, unless you have a medical justification for not being vaccinated. The staff standing behind me are the people who have to put their lives at risk, the health staff in New South Wales. I am, as the Health Minister, extremely frustrated when I hear of people getting out and having demonstrations that put themselves at risk because they'll end up quite possibly in an ICU bed or a hospital, and they put our health staff at risk. So it's not just about you folks, it's also about looking after the rest of the community, and particularly those health staff who, when you're in deep trouble, you'll be actually looking to them to keep you safe. So just get real, go and get vaccinated.
Yeah.
We had a national cabinet meeting on Friday.
Yeah.
We also saw Mark McGowan announce a plan to reopen inboard at 90% vaccination, double dose vaccination by 12.
Yeah.
Did he mention that in the national cabinet meeting? Did you speak about that to the part of the national cabinet?
I won't discuss what occurred in National Cabinet, but look, other states will move at a different pace. We've always said here in our state, we don't want to be a hermit kingdom on the other side of the world. We want to rejoin the world. The key to doing that is vaccination. And Susan spoke about really well about where we were sitting last year. I mean, I'm surprised, even if you go back 4 months ago, to get to where we are today at nudging 95% first dose is amazing. And that's been the key that's kept people safe. So we've made a number of changes to our roadmap to bring things forward. We obviously want to be in a position where people are able to travel around the country. We shouldn't be a set of penal colonies. We should be one nation, and the quicker we can get there, the better. But ultimately, we want to move with the national plan. We want to open up our state. Vaccination rates have been key to that. I don't want to comment on other states. I'll have my disagreements with them on other matters, but they're obviously got to make sure they keep people safe. And Susan said, and the Health Minister spoke about it. If you look at the vaccination rates in regional and remote communities here in New South Wales, it's incredibly strong and high. When you look at other states, even WA, the vaccination of their Indigenous population is nowhere near as high as it's been in New South Wales. So they will have concerns and matters that they have to deal with before they open up. But we're in a very strong position here in our state. And I'm happy about the fact that people will probably be able to travel to Bali before Broome, but ultimately that's because of the effort of people of our state.
What is the Indigenous vaccination rate in New South Wales?
I think double dose is above 70%, to above 80. Susan Pearce is all across it, above 80.
Premier, with you easing the restrictions tomorrow, what will that say now about ongoing compliance, though? Will that still play a role? I mean, obviously with the cafes, for instance, we're still at 2 square meters.
Yep, so we're still at 2 square metres, and we know going forward there will need to be some restrictions that remain in place. We have our regular weekly COVID and economic recovery meetings. We always discuss the economic and the health matters that are in front of us. Our QR codes remain in place. Tracking and tracing is still at the moment an important part of assistance to our health teams, but that's not going to be these measures aren't going to be around forever. But ultimately, we don't want to go backwards. We've still got face masks that we are required in shopping centres and hairdressers and beauticians and the like, as painful as it is, and I know they're annoying wearing them standing here, but they'll be in place until the 15th of December. But we want to get back to normality as quickly as possible. We need to do it as safely as possible. So if we can continue to treat everyone with kindness and respect, the rules aren't there for the sake of it. They're there to keep people safe. And as we open up, we want to make sure we don't go backwards. So whether it's QR codes, 2 square metres, they are in place for some time. Having said that, Chris, we're always looking at revisiting it.
You'd be excited that we can dance at nightclubs.
Absolutely, we're going to go kid it. Well, I'll tell you what, the health staff here will be, because tonight, is it tonight or tomorrow night? Tomorrow night's a massive party at Kudos Arena to celebrate all the work they've done. And the health minister's right. They are the stars that have taken over Kudos, and the work and the effort they've put in this program has been amazing. And I don't believe they've got the credit that they deserve in terms of being on the front line during this period. But yes, Chris, we'll hit the dance floor together. Looking forward to it.
Just in terms of cases, the information you're getting, how do you think that they are tracking with opening up, and just also in comparison to testing levels as well?
Well, the testing level is still very strong. Obviously, the case numbers are below where we expected them to be, but we also know that as we open up, case numbers will increase and hospitalisations will increase as well. There's a long journey to go, but the best thing we can do is get the vaccination rate closer to 95%. We want to hit that rate, and we want to have a strong booster program rolled out as well. We've seen around the world, as countries have opened up, many have had challenges. We don't want to see that here in our state. The best thing we can do is continue the booster program and have a strong program in place. That's why we've set up this centre here. We've worked with the council to do that, because we want to. Chris asked the question earlier about what's the role of Homebush going forward. Well, we want to keep it going because it's been successful. We're not going to. We'll always fight the Commonwealth in terms of our allocation of funding, but we're also going to stand on our own 2 feet. When it came to our remote and regional vaccination program, we didn't wait for the Commonwealth, we just went in and did it. And we'll continue to do that. Our number one priority in this state is to keep people safe. We want to open up, we want to make sure that businesses can open and people can remain in jobs and recover every single job that we've lost during Delta. I'm confident that will occur. I think what we've seen today, since we've opened up the state, that there has been such a strong response. Tomorrow we go to 2 square metres inside and another range of changes. That will make a real difference, but Ash, numbers will rise. Cases will increase. They're below where we predicted they would be, but that does not mean there are not challenges down the road for New South Wales, and that's why we need to continue to make sure we treat people with kindness and respect. We abide by the rules that are in place. They're not there for the sake of it, they're there to keep people safe.
Just in terms of National Cabinet, just back to, obviously the 5 to 11 vaccination program was discussed.
Yep.
It has to be approved by Targi. Is there any time frame that you think that was perhaps discussed when we can see that?
No, I mean, look, we obviously got a briefing in relation to the progress there. It's a matter for Targi. What's important from a state's perspective is that once vaccination rates for children are approved, that New South Wales is ready to go and to ensure from a service delivery perspective we continue the success that we've had over the last 12 to 18 months. So from our state's perspective, we're not advocating for the date to be brought forward. What we're saying is Targi should do their work. Once those vaccines are deemed to be safe for children, then New South Wales stands ready to ensure a strong rollout here, just like we've seen over the last 12 to 18 months.
Is there anything that can be done with, for instance, WA, where obviously it's lagging on the reopening? We are seeing a problem emerge where people who are New South Wales residents are trying to get home to see loved ones who are ill, loved ones who are perhaps dying. They can get in, but they're still forced to quarantine. There's still a million hoops for them to jump through. Essentially, at the end of this, do we need to just come to a better arrangement when it comes to dealing humanely with people between these states?
Look, I mean, it's been incredibly sad for many people. The health minister here has dealt with many exemptions over the last 12 to 18 months when people have had loved ones dying and have not been able to be there at what is an incredibly important time. And it's been very, very difficult for many families. Even since the time that I've been Premier, I've tried to provide and work with premiers on compassionate grounds when these situations occur. But ultimately, we're one country. I've always thought in New South Wales we're not defined by our state, we're defined by our nation, and we're Australians first. So the faster we can open up, the better. I will make the point, though, that our vaccination rates in New South Wales have allowed us to move faster than we first envisaged. and other states do not have the vaccination rates that we've seen in New South Wales. So the effort, it's not really for me to blame other premiers. I would say they've got to deal with the circumstance they face, and we have to deal with the situation that we're in. And what's helped New South Wales has been our people. Our people have come forward, done the right thing, got vaccinated, and that means we can open up and rejoin the world. Not just we want a united country, but also we want Australia to rejoin the world. New South Wales is leading the way. The move that we made to remove hotel quarantine for fully vaccinated people coming into Australia has led Victoria to follow. And we're now getting back to normality. I've seen some very encouraging signs from the Prime Minister that we're not just talking about returning Australians now. We're getting tourism back. We're getting business back, and that means that that's going to really help our state going forward, particularly with labour shortages that we're finding right across New South Wales right now. We've dealt with the issues in relation, well, partly dealt with the issues in relation to agriculture, with the federal government coming on board with those visas. But there are still challenges, particularly in the hospitality sector, that need to be dealt with. So New South Wales is leading the nation out of the pandemic, but ultimately, it's not just our government. I think the people of New South Wales see themselves Australians first.
You want to encourage people to come back into Sydney CBD.
Yep.
The annual flight rail is going to be down for 18 months. That's tens of thousands of people who would have been commuting into their work in the city. Don't you think that's going to make people want to work from home during that period?
Oh, it's not helpful. And it's clearly, and it's something that we will work through. It's not a situation that's unique to New South Wales. I mean, these trams have had, it's a substantial issue that needs to be dealt with. I understand the UK as well. So, but we want people to come back to town, and we're obviously putting other services on, bus services and the like. So they will be important in making sure that there are public transport options available. That's certainly what I'm committed to. I've spoken to the Transport Minister about it. He's obviously looking at the issue with fresh eyes. He's coming in, whatever we can do. We think that's a worst case scenario, 18 months, but we'll make sure as we move through this challenge that there are always public transport options available so that we minimise any inconvenience. We do need people to come back to the Sydney CBD. I want a thriving city. We did that last year. We put a lot of effort into bringing back fun and entertainment into town. People aren't going to come in here, there's not much to do. So we are certainly going to continue that effort, and what worked last year will work again. And there will naturally be, in a post-pandemic world, a balance between working from home and working from the city. And whether that's here in around Parramatta or it's in the Sydney CBD, and that can be a positive thing as well. That really helps local suburbs in terms of small business, but ultimately we're a global city, and there's two things we can do: is get people back into town, get the borders open so that tourists come back in. And if you go down to the Sydney, if you go down at Circular Quay, there are so many small businesses that have been doing it tough, not just for 3 months, for 18 months. Some of these small convenience stores, you speak to the owners down there, it's been hell. I mean, they rely on international tourists to survive, and they're still standing. They're incredibly resilient, and so the quicker we can get the border open and people back into town, and if you do come back into town, go and visit some of these small stores if you've got the time, because they need trade, and if we can go and help them as we wait for tourists to arrive, I think that would be something we can all work together on achieve.
The Premier's partly been held for that small business in the city because of the light rail that came before it and the construction. You must be furious that we have 7-year-old trams in this state when your government has placed so much of your position, your reputation on this light rail option. I mean, it's not a good look, is it?
No, it's terrible. But it's a challenge we've got to deal with. And obviously it's unacceptable. But what I can do as Premier, what my team can do, is ensure that there are public transport options available to minimise any disruption. That's exactly what we're going to do. There are always going to be challenges though, and there'll be other ones that come our way. When you're building $108 billion of infrastructure, when you're building the roads, the public transport, the schools and the hospitals, challenges will come our way. But I'd rather have challenges from things that we are building than have the challenge that comes our way from not building anything at all. And that's what we saw under the previous Labor government. They opposed the construction of the schools, the hospitals, the public transport, the road network. And that's not an acceptable outcome. We are building our state for a brighter future, and there'll be challenges that come our way. What we can do when issues like this occur is deal with them immediately, apologise for the inconvenience that's occurred to the people of our state who are impacted by it, and ultimately ensure that there are alternatives to minimise inconvenience as we move through, and that's exactly what we're committed to doing.
Are you going to look into it though, that perhaps that things could have been done differently?
Yeah, absolutely, absolutely. I mean, we've come to office, over 10 years ago, and the practices back then should probably you need to learn from things that don't go so well. Things have gone really well with a lot of the infrastructure projects. Many projects are on time, were delivered on time and under budget. But it would be remiss of any government to not, after projects are delivered, to sit back and look at what didn't go so well and how do you change those practices going forward. And I think there are many lessons, particularly on the light rail, for the government to learn from going forward. And it's important that we do, because we're not going to stop. This is a government that's going to continue to build. We're going to continue to build public transport. We're going to continue to build the roads, the schools, the hospitals to make a difference to people's lives. And you can't doggedly pursue the path of the past if it hasn't worked as well as it should. So I know through Infrastructure New South Wales, Simon Draper and the team there, after every project that is completed, we look back and analyse how things could have been done better, if at all. And if they could be done better, we will change our processes going forward.
What went wrong then in the West Light Rail? What could have been done better?
Well, I'll have to get advice on that, James. I mean, it's early days. Let's have a look at that. Ultimately, this is not a unique situation to New South Wales. This is a global issue. Look, there has been criticise the government in circumstances where things don't go so well. Completely agree with that. But ultimately, I won't apologise for building a better future for the state, and that's exactly what we've done. When you're building light rail, train services, extra train services, metros right across the board. I was down there. I mean, if you look at the last few days, I was out with the Transport Minister yesterday as we broke through the M4, M5 tunnels. Once again, a project that Labor opposed. They opposed the construction of that road that's going to transform Western Sydney. Transform Western Sydney. You can get from the Blue Mountains to the Sydney CBD without passing one traffic light. We were down the other day at Barangaroo as we had another breakthrough, as the Metro City and Southwest continues to forge forward. There is so much happening right across the state. There are more cranes over the skies than anywhere, arguably, in the world. And sometimes, from time to time, things won't go so well. If they don't, we will come together and work on how we can improve those things going forward, and we will.
What about the Sydney Light Rail? What about the CBD Light Rail?
Yeah, that's a great example of a project that was not built. The cost escalated well above what it should have been, and though when that occurs, you look back, and I know particularly with the light rail, that Infrastructure New South Wales are looking at that, or have looked at ways it could have been improved. But once again,
it's going to cost another $500 million in compensation. It's going to take it, almost up to $4 billion.
Yeah.
Next time again, would you spend $4 billion on City Light Rail?
What was that?
If you had your time again, would you spend $4 billion on a city?
Oh well, I'm not going. Obviously that's the previous decisions were made in relation to it. But I think if you walk down George Street now, what a great place! It's opened up George Street for the future. I think George Street's thriving under the changes that have been made. Could that project have occurred better and could have been procured in a better way? Absolutely. I mean, yeah.
Just on supply, sorry, can we be assured on boosters we're not going to have the Hunger Games of vaccines that we saw, to quote your minister?
What was that?
You called it the Hunger Games of vaccines a few months ago.
Yeah, and how well, no, well, we are.
What's the Commonwealth saying?
We think there's clearly enough supply. We'll continue to work with that as the colourful minister's quotes were true, and he delivered. And that's, I think we should sit back and think about the success that we've had here, because I know we can often be negative around the issues that have occurred in the middle of a pandemic. But we are in a state which is opening up first, that recovered every single job we lost last year. We are in an incredibly strong position as we rejoin the world. We've kept people safe. Susan and I were just talking earlier. If we look back last year and we were sitting in crisis cabinet, what we were looking into in terms of the hospitalisation rate and the death rate that we expected in New South Wales. The results are incredibly pleasing. Now, it's not over. There is a long way to go. But to the strong vaccination rate, as we roll out this booster program, it won't be the Hunger Games. We will make sure, though, that New South Wales continues to lead. And that means not waiting for the Commonwealth, but driving the program, having the facilities in place. The Health Minister is right. We do want to move to a more normalisation of the booster shot program, and that's why we would say it's best administered as we move forward through GPs, as you would in your ordinary course receive vaccinations. But we're not going to wait. We're going to have the centres continue to open at Homebush. We're opening this centre now, and we'll do everything we can to provide the booster shot program and allow it to be incredibly successful as we move forward.
Ms. Pearce, just on the 12 to 15-year-olds, if that's okay. So we hit 80% first dose coverage of 12 to 15-year-olds yesterday, but there are some areas, particularly, I think it's Cumberland even, and Canterbury Bankstown, parts of South West Sydney, parts of regional New South Wales, where the rate is well far below that. In your opinion, is that an issue of access or hesitancy, and would you consider administering the vaccines in schools?
Look, we're obviously very keen to get that rate up as high as we possibly can. It's really important for kids as they're going back to school. We always will appreciate the rates won't be entirely uniform, but absolutely we are working with all of our local health districts about school programs. And every single local health district in New South Wales will be looking at what they can do to support schools across the state to vaccinate any children. I do not think it's an issue of access, however. There are so many delivery points now for vaccine, both Moderna and Pfizer. So there's no reason from a distribution or supply issue. We're very keen to see that rate increase, and we think we can do more there.
Thanks, Deborah.
Thank you.
Thanks, everybody. Thank you. Thanks. You want to do the selfie now? Yeah. You'll do it. Amazing. Do you want to do it?
Should we?
We'll be back. So what are we doing outside? Then we can do it. That's why he's figuring on. What's that?